Aloha. I'm Dale Rosenfeld with Conscious Cannabis Conversations. Today, we're going to be talking with Wendy Gibson Viviani, and we'll be discussing chemovars, chemotypes. There's a difference. We'll learn together. Wendy, thank you for joining us today.
Good to be here. Thanks for having me, Dale.
Please tell us what the difference is and why should we care?
Okay. Well, one of the questions that cannabis nurses get asked all the time is, what product should I use to treat my whatever pain or epilepsy? And I want to give you some tools to help you make those decisions. And one of those is, can I throw a slide up to show you?
Yes, please.
Okay. So there are two ways to start making decisions on what to use. And one of those is called chemovars and the other is called chemotypes. And the difference between those two, oops, sorry, I'm all over the place with the slides. So chemotypes are based on the THC and CBD ratios, largely. And chemovars expand that to include some of the terpenes.
Okay, so chemotypes are about ratios of THC, CBD, CBG, any of the other cannabinoids.
Yes.
But chemovars, variety, var is how I think of it,
Exactly.
includes not only the ratios, but also terpenes. So this is not a simple plant. This is not a one-cell plant. This has many, many elements to it.
And I encourage patients to learn as much as they can about not only the cannabinoids, but the terpenes and the other chemicals that are in the plant, because many of them have potential medicinal use, and knowing what's in your plant is really essential.
So now, okay, so today, though, we're not going to talk about terpenes and chemovars. We're going to try and just keep it to a chemotype discussion, and we'll meet again. We'll have another conversation.
Sure. About... And let me share one of the resources that I used to get the information that I'm going to share with you today. And it's called Your Cannabis CBD THC Ratio, and it's a guide to precision dosing for health and wellness by a cannabis expert named Uwe Bleshing.
Great. Great. Okay, so let's everybody take a look at that, and then we can remember that's a book that's, I'm sure, available on Amazon, or from, if you want to, if you're struggling to find it, let Wendy know and she'll help you find a copy of it. So we'll have her contact information later.
I have a library and I do loan books, and this is one that I have multiple copies of. It's anyone on Oahu wants to borrow one.
Great, great. Okay, so let's stop that screen share. And now let's talk about type 1, type 2, and type 3 of the chemotypes.
Oh, no. Let me go.
Yes, go ahead.
Back to the slide then.
Okay, I won't share yet.
Sorry. Okay, so as you can see on the slide, type 1 is THC dominant. Type 2 is more balanced, almost equal ratios of CBD and THC. And the third type is CBD dominant. And when we're talking about the chemotypes, we're looking at mostly the CBD to THC ratio and not the other way around. Does that make sense?
CBD to THC. So if I have a higher equal ratio of CBD to THC, if we talk about it that way, we're saying there's 20-1 CBD to THC is how it would be expressed.
Yes.
Versus if it was THC dominant, number one, it would be 1-20, because the THC is always the second part of it, correct? Well, if it was THC dominant, it's 1 CBD to THC as an example.
Maybe I should clarify. If you're talking about THC dominant products, they usually have the THC amount first. If you're
Okay.
talking about the equal balance or CBD dominant, the CBD tends to be the first one.
And that's just how it's expressed by the
on the
person
labels.
on the labels. Okay.
Yeah.
Okay. So if it's a THC dominant, that's what you're going to mostly see is the numbers relating to THC, which
I
is the
believe so.
psychoactive part.
Yes.
The near equal ratio of CBD to THC, you'll see it, and it will be expressed first CBD, second THC. Is that correct?
I believe that's how it.
Okay. And
Okay.
then CBD dominant, it would also be CBD to THC ratio, CBD being first.
Yes.
Okay, great.
Okay. So
Great.
let's go from there.
All right. So type 1, let's see what type 1, let's find that type
So
1.
THC dominant, the most intoxicating type, you have a higher risk of side effects and also of cannabis use disorder.
With a higher THC, there is chance of cannabis use disorder.
Much higher chance, yes.
Okay.
So with type 1, it's most useful for treating pain, nausea and vomiting, spinal cord and head injuries, as well as glaucoma. That's what they have found it to be most useful for.
So for type 1, so I, for instance, have a lot of back pain, and I do many other things as well as cannabis. But so for my type 1, having a higher THC, a THC dominant. But I don't know that I'm that quite that bad. So could I instead choose a different type?
Absolutely. So type 2 is also useful for treating pain. That's the more equal balance of THC and CBD, or CBD to THC, and has a wider window of treatment options. So there's a prescription drug that's a 1-to-1 ratio of CBD and THC, and it's being used to treat multiple sclerosis. And it's available as a prescription in 30 different countries. It's based on plant medicines. These are not synthetics. But the type 2 has also been found to be more useful for treating cancer pain and for specifically nerve pain, so neuropathies.
So in type 2, we're looking at more equal ratio. Yeah.
Yes.
Okay.
So less addiction potential, less chance of side effects. The CBD helps buffer out the psychoactivity of the THC. So these could be like 1-to-1 or close to 1-to-1 ratios.
Okay. CBD buffers the THC. I like that concept, that we don't have to get as high as possible, psychoactive as possible. We can have it buffered for other elements.
Absolutely. So, yep, less chances of having side effects. It's, they work better together, right? The power couple. You can use lower doses of each when you use them together.
Okay, great. Lower doses of it in order to.
So, and then type 3.
Okay.
Might be best for treating certain disease processes too, such as epilepsy. And also for potentially reducing the use of other addicting substances such as opioids. So with this one, you have the least chance of side effects as long as you stay with lower doses. With higher doses, you could have drug-drug interactions if you're taking other medications. But you generally see the labels as 20-to-1 or 10-to-1, or well, even 30 to 1. I actually found a product that's 40 to 1. So, 40.
And yet it's still whole plant medicine because it's not just CBD.
That's right. These are not isolates. These are whole plant extracts, but with known quantities of THC and CBD and the ratios. So yes.
So tell me, how difficult is any of this to find? If I go to a dispensary and I say, I want a type 3, what would they do for me?
I really don't know exactly what's available at the dispensaries, but I think a fair amount of it is high THC. And a lot of patients grow their own medicines because they want the medicines that have more CBD and other cannabinoids in them, such as CBG or CBN or CBC.
So this is pretty advanced knowledge. And at the same time, it's the basics, isn't it?
Yeah, we actually know quite a bit about cannabis, but there's a lot more that we need to study and learn about to really get the art and science of medical cannabis down. It's, we are definitely making some good headway, though. The cannabis researchers are just amazing in their knowledge base. I'm learning so much every time I listen to them.
Great. Anything else you'd like to make sure that we all understand?
That there are resources out there. You just have to ask. And there are a lot of really good websites and books and videos, and I've made a list of those. If anyone's interested, just send me an email request for resources to learn more, and I'll steer you to some of the ones that I used to learn about all of this.
Wendy, once again, you are a wealth of knowledge. I appreciate you coming on here, talking with everybody, being open to questions. I hope that we are seeing some questions and that everybody is willing to share what they know as well. We're all learning. We're all on a learning curve.
Well, thanks for opening up the doors and giving me the opportunity to share and for people to connect.
Thanks. Thanks. Next time, maybe Chemovars, maybe something else.
Maybe.
But we are rescheduled. The newest news as of yesterday was that we have rescheduled cannabis into a Schedule 3 from a Schedule 1. Maybe more research can get done now too.
Yeah, well, it hasn't happened yet. There's a process has to go through a budget review, and it also has to go out for a public comment period, but it's coming.
Okay.
Yep, watch for it. And
Wonderful.
cannabis nurses are on their way too.
Yes. Thank you again.
We hope. Thank you.